All right, guys, welcome back to the channel. My name is Drew. If it's your first time here, a big welcome. Here we are studying and learning, exploring functional anatomy. And in today's video, we are going to be looking at the forearm extensor group. So there's, as you can see, there are a fair few muscles here. So we're going to be checking these bad boys out. And as always, we're using the Complete Anatomy app, which you'll find the link in the description below. We're just going to be using some of the tools and functions, give you a bit of a sense of how to use the app, as also to see what it can do. And if you have any questions, please feel free to whack them in the comments in below, and I'll get to them when I can. I love answering your questions. They're really cool. Let's just do a bit of an overview of the forearm extensors. So these are the ones that if you're standing in the anatomical position, so that's in this position, palms forward, this is the muscles that are going to be on the back of your arm, the extensors. So they're a big muscle group, and they essentially cross the elbow joint. So you have some that are attaching onto the humerus, crosses the elbow joint, and then they come down and they essentially spread out into your fingers and across your wrist. And so these is your essentially your finger muscles and your wrist muscles. Because these ones have some, they cross the elbow, they do have some elbow flexion, so they help with your tricep work. So I think tricep work is forearm extensors, bicep work is forearm flexors, and we'll do the forearm flexors in the next video. So we'll go from kind of anterior to posterior. So here we have the bicep brachioradialis. So it's technically this is one of your bicep muscles. It goes from the kind of the lateral aspect of the humerus here, and then threads down, and you'll see it attaching onto the radius just here. Yeah, so brachioradialis. All right, so that's your hammer curl muscle if you're into weight training. And below that, we have the Extensor Carpi Radailis longus. So extensor, so it's one of the extensor muscles. Carpi, meaning it's going to go to one of the carpals. And radialis, meaning it's on the radial side. And longus, meaning it's a long, thin one. So if we isolate this bad boy. So Extensor Carpi Radailis longus. So the thumb side is the radius side. And you can see the tendon here is attaching onto the second metacarpal, so carpi here. This part of the humerus where it's attaching onto here, so we go across here onto origin insertion, the inferior 1/3 of the lateral supracondylar ridge of the humerus. So this kind of ridge here, that's the supracondylar ridge. So this is the lateral condyle of the humerus, and this is the medial condyle of the humerus. You may have heard of an injury called lateral epicondylitis or tennis elbow. So this is the attachment point of all of the forearm muscles here, and so you can get inflammation of either the tendon or a bursa that sits underneath there. So that's the lateral epicondylar region, and this is a supracondylar ridge there. And then it's got a long muscle, long and thin, attaching to the second metacarpal. So we go over here to insertion, dorsal aspect of the base of the second metacarpal bone here. All right, so we go back. Next one down, we are looking at Extensor Carpi Radailis Brevis. So this is going to be a shorter one. So let's isolate this bad boy. So origin, lateral epicondyle of the humerus via the common extensor tendon. So the common extensor tendon is going to be this tendon here. And this is where you get into the trouble with that lateral epicondylitis, because you're getting this kind of shared tendon through Extensor Radialis longus through here as well. They kind of meld into each other a fair bit. And this one's right on the kind of the lateral epicondyle. So this is the one that's going to really be pulling on the bone. And typically it's the one that gets really inflamed. But it's very difficult to separate them. You're not really going to be able to isolate these muscles when you're working. So for example, I've got a client who's got bilateral epicondylitis, and we are working basically from the neck down the biceps, triceps, through the forearm, right down to the fingers, and then focusing on this muscle belly through here to really treat this condition here. But we're not doing a lot of techniques right on the attachment point here because it's a very sensitive area. We tend to stay off with the attachment point and work more into the muscle and the connective tissue around it. On the insertion, dorsal aspect, the base of the third metacarpal. So this one goes to the third metacarpal or your middle finger. Going that way, not the other way. So your middle finger bone. Middle finger bone? Yeah, middle finger bone. All right, let's go back. Next one down. This big one here. So Extensor Digitorum is the big one. So you can see here this common insertion point where all these muscles are attaching through here. So let's isolate. So you can see this is a bigger, thicker forearm muscle. And you'll notice here that it's going from the lateral epicondylitis of the humerus, crossing the elbow joint there, and then spreads down, and it has a tendon which spreads into these three sections here. So if you go to insertion, dorsal aspect of the base of the middle and distal phalanges of the index finger, middle ring finger, and little finger. Okay, so if you're looking through here, so these are the metacarpals, the longer thin bones, and then we have the finger bones here. So that's a phalange, and phalange. So proximal phalange is the one closest to the midline. Distal phalange is the tip of your finger, and middle phalange is in between the proximal and the distal one. And you can see here, there's got this really unique way that the tendon splits off. And so it attaches onto the medial phalange, and then it has this kind of branch that comes on and onto the distal one. And that gives you a lot of the dexterity in your fingers. So it's quite a unique kind of structure makeup there. Okay, let's keep moving on. And then we have Extensor Carpi Ulnaris. So it's on the ulnar side. So ulnar is always on the little finger side. So if we isolate this one, flip around. Again, we're kind of coming into that lateral condyle here. And then it's going to thread down to the ulnar side. And that's attaching onto your little finger, your pinky finger here. So insertion medial aspect of the base of the fifth metatarsal bone. So through in here, and actually we've got a nice acupuncture point just in here, small intestine 3, which is a really good acupuncture point for, believe it or not, back pain. So that's the Extensor Carpi Ulnaris. Come back. And we have a couple more here. We've got this one underneath here, Adductor Pollicus Longus and Adductor Pollicus Brevis. So you have, these are your two thumb muscles. So let me show you here. So brevis coming down, touching onto the medial phalange, and then longus, Adductor Pollicus longus, attaching onto the proximal phalange. And this tendon here is Extensor Pollicus longus. So you've got three muscles for your thumb: Extensor Pollicus longus, Extensor Pollicus brevis, and Extensor Abductor Pollicus longus. So your abductor muscle is going to be like when you do your thumbs up, like that's abduction. Okay, so out to the side. So you want to be able to do that, out to the side, abductor, whereas extension will be like that way, so up this way, so kind of lifting your thumb back that way. The three muscles for your thumb. So let's isolate them, have a look. So this one is coming up more onto the mid shaft of the ulna, so about a third of the way up. So origin, posterior aspect of the proximal half of the ulna, middle 1/3 of the radius. And attachment points onto that proximal phalange there. Good. And then if we isolate Extensor Pollicus, we can have a look at there. Isolate that one. It's a bit lower down through here. And there's a condition called de Quervain syndrome where you get this inflammation of 1, 2, 3 in this area here, and the tendon that's coming down into your thumbs get inflamed. It's kind of like in a tendonitis, but of your thumb muscle. So, you know, I've seen clients with that when they do particularly a lot of hand work, a lot of typing, a lot of computer-based work, playing instruments like fine motor control type work as well. We have this thing called a retinaculum. So I'll just put it on this side here. So the retinaculum is this really strong wrapping of connective tissue that wraps right around front to back, just above the wrist joint. Okay, so they'll be just on through here. And what that does is it essentially anchors all the tendons in position here. Otherwise, when you contract the muscle, the tendons will just kind of like come off the bones. So you've got these retinaculums, really strong connective tissue, which keeps the ligaments in position. So if we go into movement, motion, extensor digitorum, finger abduction, let's have a look at this movement. So here the muscles are contracting, and you go follow the line of the pull. You can see that as it's pulled there, it's just spreading the fingers out. So that allows you to spread your fingers out to get that gripping sensation. And then if we go into extension, so hence the extensors. So from gripping, you're going to straighten the fingers out. So this is finger extension. So basically the wrist is in neutral and you're just straightening the fingers out. Like so. And then from there, you go into wrist extension. Look at this movement here. So it's almost a 180 degree. It depends on the bones in the wrist where they're contacting, but typically you should get 180 degrees through here. And this movement is from the forearms. So if you want to stretch your wrists out, you flex them fully, and that'll stretch the wrists out. And the way to stretch the wrists, you need to do them with the elbows straight, so you get the wrist extensor to come across onto the lateral epicondyle, and then also with a slight elbow flexion to get the ones that are coming off just the forearm, off the radius and ulnar. Now, if we look at the Extensor Carpi Ulnaris, I'll look at motion for that one. Here we have wrist adduction. So bring towards the midline. So this one here is giving you that little kind of that movement there. So little finger out. Okay. So in the anatomical position, your palm will be forward. So that'll be little finger coming in towards the midline through there. And then also it helps in wrist extension. So each one of these muscles individually on their own is quite small and weak, but when you add the group up together, muscle group, when they work as a unit, they're quite powerful and quite strong. And you can certainly train these muscles. In fact, one way we teach people to recover from lateral epicondylitis is we strengthen these muscles up with a lot of very gradual, progressive eccentric loading. It's one of the best ways to kind of help rehabilitate tendon problems. All right, let's go back here. Let's have a look at another one for motion. Extensor Carpi Radailis Brevis. So we're now into hyperextension again, but now we're on the radial side. Good. And then we are on wrist abduction. So that's the thumb in the anatomical position, palms forward, your thumb's going out. So you're basically doing this kind of movement through here. Perfect. And let's just review the next one up, which is Extensor Carpi Radailis Longus. So we've got, again, wrist abduction. So it's on the radius side. So it's going to be helping to pull the wrist into abduction. And all these little fine movements, this is where we get a lot about fine motor control. So you can do really fine movement, like I like to paint figurines, so painting figurines, or knitting, or playing an instrument, or typing, something like that. It's what the fine motor control. When you add all these little movements together, and particularly all the little finger muscles, then you get this dexterity. And like every muscle, they can be trained, and you can do really, with practice, lots of very fine motor movement. And then, of course, we have hyperextension of the wrist, or full wrist extension. So take from the side, wrist flexion into wrist extension, wrist flexion into wrist extension. So we turn it around the other way. So you can see the muscles contracting, so it's creating a pulling movement this way, and it's going to pull on the bones this way. So that's how you get that upward movement, like so. And the last one here, let's go review Brachioradialis quickly on the motion. This one's the elbow flexor. So just coming just off that supracondylar ridge up here, and it's attaching onto the radial stylo process. So it assists with the bicep brachialis here and the bicep brachii here. So pretty much in any bicep curl, it's going to be assisting. But if you really want to isolate this one, you do thumbs forward, okay, into what's more called the hammer grip, and that helps create the palm over, so pronation. And that is pretty much the forearm extensor group. Very, very difficult to isolate. You can see 1, 2, 3 muscles here, common tendon there. So essentially these are one muscle in a sense. And then you've got the Brachioradialis and the Extensor Carpi Radailis coming down more on the thumb side, thumb and second finger side. And then you've got the Ulnaris muscle coming down here, Extensor Carpi Ulnaris, and Extensor Digitorum Minimi coming down to the little finger. Digitorum Minimi is the little finger. So you've got one muscle for the little finger. Now, on the forearm, on the flexor side, you've got matching muscles. So all these muscles here. So there's an Extensor Carpi Ulnaris. So there's going to be a flexor Carpi Ulnaris. There's a Extensor Digitorum. There's going to be a flexor Digitorum. So you're going to have matched muscles on the forearm. So you've got equal ability to flex and extend the wrist. So how do you train your forearms? One of the best ways to train forearms is to do weight training. So dumbbell work, kettlebell work, barbell work, because you are going to be doing a lot of gripping. And when you grip, particularly when you're doing dumbbell free weights, requires a lot of control of the dumbbell or the implement. And that's a great way of training forearm strength, particularly. So in neutral, very, very good way of training forearm strength. One of the exercises I've given my client is just to get a towel and just to kind of roll the towel up with the forearms, and you get a nice stretching movement through the forearms, but you've got to make sure you do it both ways. So you go forward and then you go back. So you get the extension component and you get the flexion component. Okay. So that's just a super quick overview of the forearms. We'll do the nerve supply of the Extensor Digitorum here. Let's just go back to our information. Innervation is the posterior antebrachial interosus nerve C7, C8. So that's coming out of the base of the neck. So any kind of injuries to the base of your neck may affect your extensors. That's also one reason why we always address the neck up here as well. So you've got the, let's see if we can show the nerve supply. Motion, models, okay, nerves. You can see here, so you've got the muscular branch of the radial nerve to Extensor Digitorum. So coming out of that kind of base of the neck, C5, C6, C7, comes under the collarbone, underneath the axilla, so your armpit, Okay, kind of comes down through the bicep, underneath the extensor muscles here. So like the Brachioradialis and the Extensor Digitorum Radialis muscle, and then threads into your muscles here, and then sits underneath the muscles. So if these go really tight, you can compress and push down to the nerve supply, and that can compromise the nerve that's going down further into other muscles down the arm. So when I initially mentioned I was working with a client today, we were addressing the neck initially just to free up anything through the neck and shoulders to address the arms. I've kind of helped a lot of people who've been scheduled for surgery for different elbow problems or wrist problems, and the issues been coming out of the neck particularly. And there may have been an initial injury in the forearm, but due to compensatory mechanisms and guarding, protecting, then you tend to kind of like overuse your traps, and that locks down and then compromises that space there, and that's not much fun. Okay, so that's the forearm, a quick little overview. We could do a full video on each individual muscle, but I think that's a great place to start. It's, unless you're like doing really specialized exercise rehabilitation, occupational therapy. I mean, there are hand therapists, specialized physiotherapists who just work for the hand and the wrist because it's an incredibly complex region. So unless you've got like a very specific injury where you've had tendons severed or nerve damage, and you need that really kind of hands-on one-to-one expertise, essentially you just treat the forearms as one muscle group and you train grip strength particularly. So if you're coming back to your weight training or your kind of barbell, dumbbell, kettlebell training, is just over time that will train you to get really good forearms if your technique is good. And essentially the practice is you just keep everything in neutral. So when you're doing weights, you don't let your wrist go into an extension, you don't let your wrist go into flexion, and you don't let it go into adduction or abduction. You just keep it very neutral, and you actually practice gripping, like strength, like squeezing. So when you're doing presses, on the exhale as you press, you squeeze the bar. And you're doing pull downs, you squeeze the bar. And that squeezing actually helps engage the core muscles and also tensions the fascial line, depending on which muscle group you'll get into. So for example, if you're doing pull downs like chin ups or like pull downs, if you focus on squeezing your little finger, that helps to activate the bicep and the lat. If you're doing pressing movements like push-ups or bench press, dumbbell pressing, barbell pressing, if you focus on squeezing your second finger, that helps activate the chest as well. You can try it. All right, so because these muscles are patterned to work together, because the chest is a pressing move, so you'll squeeze it and you'll get tricep, chest, forearm extensors kicking in. Just a little tip. All right, so I hope you enjoyed that video, guys. Quick, short, sharp. Any questions, leave a comment. Be great if you give me a thumbs up and share and like all the good things. And we'll see you in the next video. We'll be looking at the forearm extensors. Okay, have a great one.